Welcome to the University of Miami Health System Facebook Live chat. I'm Liza Fernandez. Joining me is child psychiatrist Dr. Nicole Mavrides. Now, we are having this new talk. It used to be you had the sex talk with your kids, you had the talk about drugs with your kids, and now, unfortunately, you have to have this school shooting talk with your kids. So we are doing this for you. We want you to join the conversation. Ask the questions you want to ask. We have an expert here for you. All the access you want to Dr. Mavrides. Now, what is it that you are hearing from kids about the school shooting at Marjorie Stoneman Douglas High School in Parkland?
We're hearing a lot. I mean, kids are really aware of everything that happened. I mean, kids even knew what was going on without watching the news or hearing it on TV because they were talking to their friends who have siblings there or have siblings in the middle schools. And they're worried, they're scared. They're a little bit concerned that this could happen again. They all knew that if the fire alarm gets set off, that unlocks all the doors, so it makes it easier for kids to get out, but it also makes it easier for gunmen to get in. These are kids that are as little as second and third grade know that. So it's been an interesting, unfortunate couple of weeks where kids are really talking about this stuff.
And now we always hear that kids are resilient, but can you bounce back from something like this? Not only the kids who unfortunately were there, but hearing about it on the news and adults talk about it.
Yeah, luckily kids really are resilient, and they, it may not happen the next day, but, they are gonna get back to normal if they can. Most kids, I would say more than 90% of kids are gonna be okay. There's just always gonna be in the background. Unfortunately, Parkland is now gonna be known forever as the city where this shooting happened, but kids are gonna be okay. Most kids, went back to school, the elementary school, the middle school, they went back the next day or at least the Monday afterwards, and it's back to school as usual. The kids who were involved in the shooting, the high school students, it is going to take a little bit more time. They've had this week and a half, 2 weeks off, and now tomorrow they go back to school, so it is going to take some time to see, just how resilient they really are.
Now we do hear that the best thing for kids, though, I guess those not directly affected, is to have that routine, right?
Absolutely. Resuming normalcy, normal activities, normal play dates, normal school homework, rules in the house, even for those who are affected, should be done as quickly as possible. I think that this return to school is going as quickly as possible for the teenagers. But, getting back into a normal routine helps the kids realize, look, even though this happened to us, life goes on. We're gonna keep going. We're gonna do this. And I think for parents, it's really important for them to understand that, not to, push things, not to let the kids do whatever they want, have no rules, but to kids need structure.
Right.
Even teenagers need structure. And probably more so than the little kids. And, so I think returning to that aspect is going to be really important for all these kids.
Well, again, we're having this Facebook Live here with the University of Miami Health System child psychiatrist, Dr. Nicole Mavrides. She's here for you. If you have any questions, please ask them. That's why we're doing this, right? Now, how can a parent broach this kind of conversation with kids? Do you wait for them to ask a question like, Mom, what happened that day? Or do you take the initiative as a parent and tell your kids, hey, this is unfortunately a new reality? How do you broach it?
I think that it can go either way. There's no right or wrong answer here, but I do think that parents should broach the subject, because if they don't, kids are just going to go by what they're hearing online, what they're hearing what they hear on the news. Even if it's not something that they're watching the news, parents may have it on in the background, or they might be on the radio. So it's really important for parents to bring it up. They don't have to give all the details, right? It's a difference between what you're going to tell a 6-year-old and what you're going to tell a 16-year-old.
Right.
But bring it up and saying, look, you guys know there was something going on. There was a shooting. What do you know about what happened? And find out from them what they're hearing, so that way you can maybe direct them with misconceptions, or say, yep, that's exactly what happened. You're right. And then maybe ask them if they have questions. And I think just making sure they know that they have that open ear, that open communication with you, because they may not be ready to ask questions right away. They might not have questions for another week.
Right.
But, you know, just letting them know, look, we're here for you. Ask when you need something.
Okay. And what if kids, you know, the younger ones, what if have you been seeing that they are scared, concerned, or do they just think this is not really has really happened? Are you seeing the gamut?
I think the gamut, but I think, you know, a lot of times, unfortunately, they have red, you know, code red drills. It's not maybe as frequent as they might have them going forward, but they've all had code red drills where they need to, you know, practice getting on the floor, getting onto their desk, moving to the side of the room. So even the kids that are as young as like maybe 1st and 2nd grade, they've had that practice, they've had that experience. So they may not understand to the fullest extent of what happened and how, you know, the community has been that affected, but they know that something happened. Listen, anytime, if you're in Parkland, anytime you're driving by the school, you're seeing the police, you're seeing the helicopters, you're seeing the memorials that have been put out there.
Yeah.
So kids are seeing it and they are getting it. Obviously, as they get older, they get it more. So, you know, having that conversation with everything is going to be, it's going to be an ongoing thing, probably for the next couple of months.
At least, right?
Yeah.
Okay. Well, we have a question. What about special needs kids? How would you explain something like this to a child that had special needs?
I think just using as simple of words as possible, but keeping it honest, because you don't want to lie about something or not use the correct terminology, because even special needs kids are going to be able to hear it or hear other people talking about it. So making sure, you know, look, there was a shooting, people died, it was at the high school, we're the you know, parents, teachers, police, we're making it, our goal is to make you feel safe. You know, so it's not like you're not going into such detail for them, but you're making sure that they know something happened, but that they're also going to, adults are working to keep you safe.
So at least reassuring.
Reassurance is key for all of these ages.
Every age.
Every age. Everyone needs reassurance. I mean, adults need reassurance
Right,
too. So.
Now you said something about the news, and it's almost impossible for kids not to hear this. You can't shield them. So how traumatizing, or how much TV time, news time, media should we be allowing our kids, I'm sure it depends on their age, allowing them to consume when it comes to this specific school shooting type of theme?
I really do tell parents to limit the media, limit the time that the TV is on for kids, really of all ages, but especially the middle through elementary school age, because they may not even appreciate that it's on a constant loop. So they may see things and hear about it and think that it's something new all the time. So that it's multiple shootings or multiple things. So they may not even get that. So I really think limiting exposure is important, but don't limit it to the point where you don't tell them about it. Because then they'll definitely have questions and they'll make stuff up. You know, they'll be like, oh, I heard there were this, there was 3 shooters, there was this, and you're not gonna be able to control it. So, you know, making sure kids aren't watching the news 24/7, even if you want to watch the news 24/7.
Yeah.
But they're allowed to know about it. They're allowed to hear bits and pieces, but trying to really limit the exposure that they're getting.
Okay. Well, we just want to let you know that the University of Miami Health System is offering free counseling for anyone affected, both grief and coping counseling for anyone affected by the school shooting in Parkland, and that is at the Deerfield office, which is great because that is the closest office to the affected area, and that is Monday, Wednesdays, and Fridays from 9 a.m. until 3 p.m. The number to call there is 954-571-0111, 954-571-0111. Now, you are an alumna of Marjorie Stoneman Douglas. Did your heart just sink when you heard the news of this?
Oh my God, it was horrible. It's, you know, we just had our 20-year reunion in the fall, so we've been, you know, everyone got reconnected, and I think it was devastating to think that this could happen in a place. Parkland was voted the safest city in Florida last year. So the fact that it could happen here was shocking to everybody. You know, everyone was affected in some way. Everyone knew someone who was in the school, someone who, you know, maybe someone we didn't know personally had gotten hurt, but someone that a friend knew or a neighbor knew or something. So it's a very small, really close-knit community, and it was devastating. It still is. It still is.
Just shows that no one really is immune, unfortunately.
No, but I think the one thing it has done, it's really mobilized the alumni around the country, and it's pushing people to make T-shirts and to sell things to donate all their proceeds to the school, and to be there to welcome in back the students. And all the alumni from all the graduating classes made banners to hang in the school for the returning students this year. They just hung them on Sunday. So there's things that are happening, and I think it's the testament to the school and to the teachers and to the educators that they raised us well, that we want to give back.
Well, again, we're doing this Facebook Live here for you, so if you have any questions as far as how to treat this subject of school shootings with your children, we have the experts here. Dr. Nicole Mavrides is here to answer your questions, but in the meantime, how do you balance strike that balance between talking to your kids and listening to what they're telling you? Do you just let them talk first, or how do you?
I always recommend parents letting the kids talk first. Find out what they know, let them kind of give their scenario, let them talk about what they've heard, and then be that listening ear. And then I think sometimes you do need to interject with corrections or clarifications, and a lot of reassurance, like we said before. So I really try and push parents to not be the one doing all the talking. Let your kids be the one to lead the conversation.
Okay, and what types of questions? I mean, kids have all kinds of questions on a daily basis. With something like this, I can only imagine. What should parents prepare for as far as answering?
I think that knowing kind of the basics of what happened, knowing what's being done now to keep the kids safe. Knowing what's going on in the media, just so that when they can say, oh, I heard that there was something going on with the sheriff, or I heard there's something going on with this guy. Knowing a little bit so that you can answer those questions. But again, you're not the expert either, so
right.
You can say, you know what, I don't know that. Let me find out. Let me find out what's going on. I haven't heard that story yet, and seeing what's going on. But you don't have to have all the answers,
right.
And kids are okay with that.
Good. Okay, we have a question from Michael, and he's asking, what can we do as a neighborhood to help kids going back to school?
It's a great question. I mean, I think the goal is to, again, keep things as normal as possible, but letting the kids in the community know that there are people there to help. Whether it's just giving a hello and good luck, when you see someone going off to school tomorrow morning, or I know that there's people that are saying that they want to, surround the perimeter of the school and just, send them off on good wishes. I think that is, everyone can do their part. And I think anytime you see someone who's wearing a Douglas shirt, just saying, hey, are you okay? Right. Just being as supportive as you can.
Genuinely.
And I think it's really coming naturally for most people, which is amazing. Because it's, people are really they're into themselves, they're into their phones, they're not really looking around, and I feel like, fortunately or unfortunately, in the last 2 weeks, people have been much more noticeable. I mean, I'm looking around, I notice things that say MSD Strong or Parkland Forever, or things that I'm calling people out and saying hi and what's going on, whereas, before I might not have. And I think that if people can just keep that going, it's going to help these kids going back to school and just making them feel like, that their city is supporting them.
And across the entire community, right? The
community of Parkland and Coral Springs, the community of South Florida. I mean, look, this is going national. Everyone has been affected. Anytime a school shooting happens, but especially with these kids who are so outspoken and who are really pushing things. Parkland's on the news all day, every day. So, just letting them know that we support them and that we're here for them, and if they need anything, we as a community are there for them.
Right, again, that reassurance.
Yeah.
Now, I have a 5-year-old, and the other day, shortly after this happened, I think it was the next day, he was doing his regular play, cops and robbers, oh, I'm gonna, shoot you, whatever, and my ears perked up because, I think we're all a little bit sensitive, at the very least, How do you address that kind? Is that age appropriate play? Do you address it? Does it depend on the age?
I think it depends on the age. I mean, younger kids are gonna play, like cops and robbers or bad guy, good guy. I mean, even in Disney movies, there's always the theme of good and evil and good and bad and good wins. I think where you get concerned, I think where parents sometimes get concerned is like with video games, or where the things are really so realistic. And then maybe it is important to maybe limit some exposure kind of right after this kind of event. But I think with little kids, as long as they know that this is fake and that they're not doing something to actually hurt somebody, but if it starts to become an issue where kids are acting out, or they are really getting violent, or their play becomes more realistic than just bang bang bang, then we have to think about maybe intervening.
Okay. Talk.
Yeah, but a 5-year-old playing cops and robbers, I'm okay with that.
Okay. So we're here live with the University of Miami Health System. We have child psychiatrist Dr. Nicole Mavrides. She's here to answer your questions. We are having a dialogue. We want you, though, to include yourself in this conversation. If there's any questions you have about your children, or how to broach this subject within your community, within your houses of worship, however, please, that's what we are here for. So another question that we have to keep the conversation going is what is the role of violent TV, movies, and perhaps video games? You touched on a little bit in a situation like this, as far as, is that to blame? Can we blame?
No. I mean, this stuff has been going on for years and years. I mean, first it was like the heavy metal songs back in the 80s, and then it was different movies and things like that. Listen, things are definitely much more violent and much more vivid now in 2018 than they were 20 something years ago. But it's these things are not to blame for violent acts being done. I mean, the kids or the adults who are the perpetrators of these violent crimes, there's more going on than them just being obsessed with video games or being obsessed with, violent movies. Yes, could it happen where maybe things are too much, or maybe they had something going on, and then they got so into these video games that they got out of touch with reality.
Okay.
It's a possibility, but we don't want to blame TV, media, things like that, because unfortunately that's just life. And 99% of kids are going to be fine.
And that seems like external stuff, right?
Yeah.
Whereas what's going on with some kids, it's more internal.
More internal, absolutely.
Okay, well, we have another question from Liz Beth. She wants to know how to explain to a 6-year-old about the shooters. What words could she use, and any examples that you could give her to help her talk with her 6-year-old?
Sure. I mean, I think you say that there was a bad person. And he went in and he was shooting at kids, at teenagers, at adults in the school, and that there were people who died. I think you want to be able to use these words so that kids understand it. Unfortunately, at 6, the concept of death is just starting, so they may not quite get it. But I think you can just continue to say, these are kids and these are adults who aren't going to come back anymore. The shooter, the person who was doing this, was a bad person. They were an evil person, so that kids understand this is not just any random person on the street. And just continue to tell them using very specific words. Words that 6-year-olds are going to understand. You're not going to talk about, the cops doing this or the BSO sheriffs. You're going to use the police are there to protect you. The police are going to help you with things, and they're gonna keep you safe.
What about, kids are always asking, and thank you for keep asking your questions, we have them here. Kids are always asking why. What do you tell a 6-year-old if they ask why did this happen?
I think sometimes you have to say, look, we don't exactly know why. Some people are there's some people in this world that aren't good people. They have evil, or they have anger in their hearts, and this kid had a lot of anger. A lot of anger in his heart, and we're going to hopefully find out why he did it, but we just don't know.
Okay. All right. Mariceli wants to know, same question as Lisbeth. She has a 9-year-old. Is there is there any difference between a 6-year-old and a 9-year-old? How we would treat the
I think a little bit. I mean, 9-year-olds are probably going to have been talking to their friends, and maybe have been hearing things a little bit more. So you know, you can still use the same sort of words, but then say, well, what do you know about what happened? Tell me what you know, and then using their words that they use to describe the event, then you can kind of maybe answer things a little bit more for them. You know, kids may say, well, what did he do? You know, what happened? I heard he went to McDonald's afterwards. Like, how do I know that if I go to McDonald's, something won't happen? And just continue to provide the reassurance, but, you know, using their words so that they can, you're putting it on their level for them. Mm-hmm. But it's really the same thing, you know, whether it's 6, 9, 12, 15, it's using their words and their questions to guide you on their answers.
Okay. So take their lead.
Yeah, for sure.
Donna wants to know, what types of behaviors should parents be cautious about? I guess, what types of behaviors in their kids and dealing maybe perhaps with this trauma?
I mean, things that we look for, you know, after an event like this, there's going to be a lot of kids who are going to have acute stress, which is kind of the precursor to post-traumatic stress disorder. Okay. So a lot of this stuff is, if they're going to have these symptoms, it's going to be normal. You know, where they're going to have maybe some trouble sleeping, or, you know, they might be fearful to go back to school or to go to a big outside environment. Usually that stuff goes away within a couple of weeks. But I think parents should look for kids who are kind of withdrawing, isolating themselves, not wanting to, you know, be around friends or go into sporting activities. You know, think kids who are all of a sudden maybe having accidents, bedwetting at night when they didn't before. Especially the younger kids who don't want to sleep by themselves. You know, kids who are just a little bit more on edge. You know, and those are things that make me think I should reach out and either talk to my pediatrician or to my mental health provider, to a psychiatrist or psychologist, and maybe, you know, get some help.
Okay, and along those lines, University of Miami Health System is offering free counseling at the Deerfield Beach location, which is closest to Parkland, and for grief or help with grief or coping, you can call 954-571-0111, and those sessions are available Monday, Wednesday, and Friday from 9 a.m. to 3 p.m.
Actually, it's Monday, Tuesday, and Wednesday from 9 to 3. Not yet.
Is it?
Yeah.
Okay. Monday,
Tuesday, and Wednesday.
Okay, so Monday through Wednesday. Yes. Okay, sorry about that. Samantha wants to know, when can you begin speaking to your child about mental health or things like depression?
Like, in terms of what age? I mean, I think, you know, it could be early on. I mean, you can talk about things like sadness or worries or fears, even as young as, you know, 4 or 5 years old. I think if you're talking about really finding out whether there's true, you know, depressive symptoms. I mean, you know, they're elementary school. You know, kids know whether they're feeling sad, or whether that sadness is just a moment in time, or whether it's lasting.
Okay, so that's the parents' cue is to find out whether it's fleeting. Or you're just sad because your friend was mean, or
right, normal sadness. It's there. From an event, or just, you know, maybe someone was mean to them in school, and then but kind of more pervasive sadness where it's happening every single day, or, you know, they're really just not feeling, they can't remember when the last time they felt happy, and that's where really talking about depression is important.
Okay.
And pediatricians should be bringing this up, you know, at most visits and most well visits. They should be asking about these things, about bullying, about things like that. But I mean, you could bring that up in your regular conversation with your kids to find out what's going on in school.
Right. I guess situations like this kind of bring mental health to the forefront.
Absolutely.
Right? And it's our job to keep it there.
For sure. And sometimes it's an unfortunate circumstance like this, but it does sometimes open the topic and make mental health not be such a stigma. And it really isn't. I mean, people just are getting help for these things, and it's not a big deal. It's just, you know, they're just got to find the right people to get the help with.
Okay. Julie wants to know, her 6-year-old isn't aware of the shootings. Should she even bring it up to her?
I mean, I guess if it's something that she's afraid that she might hear about it, or someone's going to tell her about it, and then she might be afraid or be mad that, why didn't you tell me about this? This has been going on for 2 weeks and no one told me that something happened like this. I mean, if she's afraid that she might hear it from somewhere else, then yeah, she should bring it up.
Kind of like a preemptive.
And again, it doesn't have to be all the details. It can just be like, something really bad happened a couple of weeks ago. This is the story. In case you hear about it, I want you to know from me. And if you do hear more about it, come talk to me, and we'll talk about it more.
Okay, thank you, Dr. Nicole Mavrides, who is here with the University of Miami Health System to answer your questions about the Parkland school shooting. We have some more questions to continue the conversation, but of course we're here for you, so if you have any, please ask and we will answer. We've got about 5 minutes left on this Facebook Live. You already told us some of the signs of anxiety, fear, depression. Should we be concerned about our kids bordering on post-traumatic stress disorder?
Absolutely. I mean, this is one of those life-threatening traumatic events that can absolutely, lead into post-traumatic stress disorder or PTSD. These are going to be the kids who are really going to be avoiding what's happening. They're maybe having flashbacks, especially the kids that were maybe directly involved in that building. They're going to have nightmares, re-experiencing symptoms, lots of the symptoms of anxiety, fearfulness, worries, kind of constantly. Mm-hmm. But I mean, the biggest ones are just some of that avoidance and those flashbacks. If kids are experiencing that, when they're at home or when they're in the grocery store or when they're with their friends, that's definitely a clue for getting some help.
Okay. What about if a child doesn't want to go to school or doesn't want to be in a large crowd, thinking about what happened? How do we as parents deal with that and try to allay their fears?
I mean, you definitely don't want to force anyone into anything, because it can definitely make things worse. But I think you just have to continue to reassure and let the kids know that, look, we are doing our part to keep you safe. This is something that does not happen all of the time, and that, maybe today you don't go out, but maybe tomorrow we try it. And maybe you don't start out going to, the Aventura Mall, but maybe, or Sawgrass Mall, maybe you go to, the strip center and go to Publix, or something first and kind of see how that goes before going out into a bigger crowd. Baby steps.
Right. Okay. We have another question here from our Facebook Live. What are some behaviors parents and teachers could look out for to prevent a situation like the shooting one? So I guess talking about the shooter, what was going on with him, in your expertise, what are some of the warning signs that adults should look out for?
Sure. I mean, I guess the warning signs are really a lot of the symptoms of depression, but we really want to look out for anger. Someone who's getting angry at co-students, at teachers, at parents. Someone who's really isolative, who's a loner, doesn't want to hang out with anybody, is using their social media for posting really negative things, negative pictures, angry words. And I think parents and teachers should really have a bit access to their kids' social media accounts to be monitoring this stuff. Looking on what are they watching on YouTube, what are they watching on TV. If there's a lot of violent things or a lot of really depressing situations, we have to start reaching out and not so that every kid with depression or every kid who likes violent things is going to turn out to be a school shooter, but we want to prevent any violence from happening, whether it's self-violence or violence on someone else. And depression can lead to, to self-harm too. So those are all things that we really need to look out for.
I guess what we've learned is it's better to be proactive nowadays, whereas perhaps in the past we would have said, oh, that's just a troubled kid.
Yeah, and I think for now the troubled kids are the ones who are sometimes being bullied or, being cyberbullied or, just something happened to them where they lost a parent or lost a friend and no one is there to reach out and help them. So, whether it's a parent, a teacher, a friend, a pastor, a rabbi, whoever it is in whatever adult can help, try and help.
Right. Okay. Well, I guess that's the point to take home. Thank you for joining us. Thank you for joining us here at the University of Miami Health System with Dr. Nicole Mavrides. We've tried to answer your questions, and again, we just want to remind you that the University of Miami Health System is offering free grief and coping sessions at its Deerfield Beach location, closest, of course, to Parkland, and that's Monday through Wednesday, 9 a.m. to 3 p.m., and if you would like to take advantage of that, you can call 954 571-0111, 954-571-0111 for Dr. Mavrides and the University of Miami Health System. Thank you for joining us.
Thank you.